Hi again. Let's talk a little bit more about socialized health care and why we do or do not need it. Um, in the United States, we seem to have a lot of people lately who call themselves socialist, and they're really proud to call themselves communist, and they put the sickle and the star on their web page, and they think they're so fancy because they learned in college about Marxism and they think it's cool. So we have all these people clamoring for socialized health care. We need it. We have to have it. We have all these poor people who don't have insurance and they can't go to the doctor, and they're filling up the emergency rooms. Do you know that most of the people who fill up the emergency rooms are people who were too lazy to make a doctor's appointment and go to the doctor when they needed to? And they waited until the thing was out of control and then they went to the emergency room? Oh yes, yes, that's true. Now, besides that, America already has socialized medicine. You might as well just call us socialist when it comes to our healthcare system. We have Medicaid for people who have a low income. We have Medicare for people who are elderly. And what the socialists don't seem to realize is that we also have state-run programs. We don't need a federal program. Our states have our own programs. In North Carolina, we have North Carolina Health Choice for low-income families who do not qualify for Medicaid. They can get health care for their children for $50 per child, up to 2 children. After 2 children, it's just a straight flat $100. It doesn't matter how many kids you have. $100 a year, your kids have free health care. And what does that health care include? Well child checkups, medicines, vision and hearing care, sick visits, dental care, medical equipment and supplies, lab tests, counseling, immunizations, hospital care, therapies, surgery, and additional benefits may be available for children with special needs. That's in North Carolina. Now, how much do you have to make to qualify for this? Well, if you're a single mom in North Carolina with 1 child and you make less than $21,000 a year, you qualify for this program. $50 a year and your child is insured. If you're a single mom and you have 2 kids, you can make up to $35,208 a year and your children are covered for $100 a year, both your kids, all the health care they need. She can have 3 kids and make $42,408 a year, this single mom, and still qualify for just $100 a year. All 3 of her kids can be covered. And it goes on up. You can have it lists up to 8 people in the family. You can look at the website. It's www.nchealthystart.org. It's right there. All the person has to do is fill out the application. You can fill out an application right here online. Who's not covered? People who make more than that can afford insurance, and if they can't, there are still health clinics and places to go. And for people to say, oh, we're clogging our emergency rooms and our people don't have insurance, you need to look at the individual states and see what kind of programs they have. See, that's not part of the federal government, so they don't include that when they talk about it on the news, and and the socialists jump up and down and say, we have to have federalized health care. They don't even talk about what the states are already doing. Individual states, and I know North Carolina is not the only one, and I would really love it if some of you guys who live in other states and you know your state has a program like this, please make a video and make it as a response to this one and let people know that these things are already available and we do not need socialized health care. The last thing our country needs, okay, is a lumbering behemoth of bureaucracy centralized somewhere in our country that is supposed to take care of 350 million people. That is what we don't need. Some committee sitting up there in Washington deciding how 350 million people should be treated, what kind of health care they deserve and what kind of health care they don't deserve. Because it would have to come to that. The bureaucracy would be maddeningly slow. I mean, you think it's slow in Europe. They don't have as many people as we have. And everybody holds up Denmark, Sweden. They don't have nearly the people we have. We have 350 million people, and you want one centralized government to control our health care? Are you crazy? I think the individual states are doing a great job of socializing our health care. We don't need the federal government to step in and socialize it more. We're already doing it. In North Carolina, we voted for healthy choice, and I'm glad we did. I don't mind paying the extra. It comes out of my taxes, but it helps North Carolinians and their children. It helps families that are struggling to get the health care that they need, and my state is doing that, not the federal government. We don't need a lumbering behemoth trying to decide whether we need an operation or not, or whether we need this medication or that medication. We need doctors deciding that. We don't need politicians deciding what kind of medications we need and what kind of operations we need and what kind of services we need. We need doctors and communities doing those things. There is a danger in socialized medicine. Have you ever heard of bean counters? You guys are, everybody is so mad at the banks because how they wasted everybody's money. And those bean counters have sat there and said, well, is it advantageous for us to give this loan? Is it advantageous for us to give this loan? And finally the government stepped in and said, you have to give the loans anyway. But those bean counters, that's what the government is going to use to decide who needs what. Well, is it advantageous for us to give a 64-year-old man bypass surgery? He's 64. He can't have that many years left, you know. Should he really? No, I don't think we should give him bypass surgery. You know, this lady, well, she's got cataracts. Well, how old is she? 90? Well, she's not driving or anything, is she? Well, she doesn't need cataract surgery. You know, mark her off. No. Well, okay, how about this child? He's in a wheelchair because of a leg deformity, and we could do surgery on him and fix that. But he's also mentally retarded, and he'll probably never do anything with his life, so oh, scratch that off. We don't need to do that because he's, you know, what good is it going to do him to be able to walk? He's mentally deficient anyway. This is what will happen. The bean counters will come in and they'll decide who is worthy of surgery and who is not. And that is something I do not want. That scares me. I don't want the government deciding what kind of medical treatment I need. And I don't think you do either. I don't know why the socialists think they do. It's crazy. Because with the federalization of it will come the rationing of it. It will have to happen. There is no other way, not with 350 million people in our country. So how exactly do socialists think that we're going to pull this off? Leave us alone. Let our individual states take care of this. They are doing a good job. Look it up. Check it out. People, respond. Tell me what your state is doing to help people who can't afford insurance for their children. Let me know. I'd love to hear from you.